Change Healthcare was hacked. It's been said that the data set handles over 800,000 doctors billing, as well as handling over 5,500 hospital systems. If you're a medical practice owner and you're having difficulty billing, there was a massive hack in healthcare, and I'm going to go into deep dive on what's happening right now. Hey everyone, I just want to talk to you a little bit about what's happening now in medical healthcare business. One of the big things is one of the largest clearinghouses, Change Healthcare, was hacked. So what happened? What's going on? So I'll try to give you a little insight into this from a long-term standpoint, but really I want to dive into the security and what's happening in healthcare when it comes to protecting your patient information and also helping doctors, clinicians, business owners deep dive into like what's really happening when you look at healthcare in general. Well, as we all know, healthcare is moving rapidly, right? And one of the big things in healthcare is there's always consolidation, there's always changes. When we had recently, we had some of the largest organizations kind of merge together. UnitedHealthcare, which makes over $300 billion in annual revenue, a large insurer. They also have Optum, which does the delivery of services. You hire tons of physicians to deliver care to their patients. UnitedHealthcare is huge. They had the opportunity a couple years back to purchase a clearinghouse called Change Healthcare. Is a clearinghouse, high level, they're the ones that help with billing. The ability to kind of send billing through the system and to communicate to all these different hospitals and practices to understand what billing needs to be transmitted so that it can be transferred and ensure that everyone knows who gets paid and when. That's the purpose of clearinghouse. So it's basically like a super highway for a lot of information kind of pass through. Also sends information back. For instance, the insurer, the payer says there's issues with the EOB or the explanation of benefits. It passes through the clearinghouse and sends it back into the right format for the hospitals and everyone to read, because as you can imagine, we have all these different tech systems. UnitedHealthcare, which is an insurer, a payer themselves, went ahead and bought one of the largest clearinghouses out there, Change Healthcare. And the reason why it was one of the largest is because it also handles the clearinghouse capabilities for UnitedHealthcare's competitors, the other payers, right? The Aetnas, right? The Humanas. And so now that UnitedHealthcare had Change Healthcare, they were able to see patient information and be able to understand how better to service patients, right? But also, let's be honest, they were able to see some of the competitors' information around what patients had different illnesses, because you have your patient illness history, you have your patient information, all of that's going through that explanation of benefits. And so now UnitedHealthcare has the ability to see all of that at scale. And one of the things that was interesting was that at the time when UnitedHealthcare wanted to make a bid to buy Change Healthcare, I think it was for like $3 billion, it was blocked by the government, the Department of Justice, saying that this was an issue because now they would have almost a monopoly of understanding patient data and patient information. Well, UnitedHealthcare was able to smooth that over from the Department of Justice and cleared the way for them to purchase. Why was this the problem at the time? No one really thought about it beyond the Department of Justice as a potential issue. But now we see that this was a real big issue because now it made them a huge target for hackers. Hackers have been around forever. I came from the network world, worked for years at Cisco Systems, understanding the need for networks to be secure, where we had things like firewalls and intrusion protection systems to ensure that when people are trying to hack into systems, you can identify them. You had things like understanding who had the AAA process, understanding who had authority, ability to change things and authorization, go into systems at will. That was baked into just basic communications via the internet, via network. But when you have now healthcare data being electronically transmitted through electronic health records, sent through the internet, there needs to be extra protection, right? And that's why we have protections around public health information, the HIPAA rules to ensure that vendors have to sign business associate agreements to ensure that they're protecting that data, and there's stiff penalties if you do not. But because there's so much protection around that, hackers see this as an opportunity because health data is so valuable. Imagine what you can do if you knew a certain individual has a health condition. Could you blackmail them? Could you set them up for failure for other ways? And that's absolutely why hackers want those treasure troves. But the key thing is, because there's so much information out there in the internet, that it has to be a big enough target to make it worthwhile, the risk. And when you have UnitedHealthcare purchasing the largest clearinghouse that has millions and millions of data of patient health records, that that is one of the biggest targets you can imagine. It's been said that this data set handles over 800,000 doctors billing, as well as handling over 5,500 hospital systems. 5,500 hospital systems, 8 out of 10 doctors are sending their medical bills through this clearinghouse. And so that's tons of information that the hackers have gotten access to. And this is unfortunate because these systems are also older. They don't run on traditional technology platforms. They are in packets that are not updated. So the technology is older. And so a lot of times when something happens, you don't have the individual, the expertise to unravel what really happened. And that's what's happening now. So Change Healthcare is unfortunately down. And because they're down, there are medical practices right now who cannot get compensated for the work they've already done due to medical billing process. And it's been down for a couple of weeks. There's workarounds. You can go back to traditional way of submitting medical billing via fax and paper, which is taking us back to the early 90s before we had Obamacare and other things to allow the easier exchange of information. But this brings up a bigger point when it comes to healthcare. We need to understand that as we evolve other systems in the world, we're talking about artificial intelligence and we're talking about NFTs and blockchain and all that, you realize that healthcare is very fragile and it can be the most important information because it deals with our health data. Making sure you as a medical practice owner understand that and getting ahead of the curve is really important. Making sure you understand who's handling the clearinghouse, understanding your billing processes more clearly. Because guess what? At the end of the day, it's ultimately going to fall on you when you don't get compensated. And we're in a situation because UnitedHealthcare is so big, they have access to so much data that they're becoming what they call too big to fail. We saw this before with the housing crisis when we had the credit crunch in the 2008s. And recently with Silicon Valley Bank, these people became too big. What's happening is they're going to shut down and stop saying, hey, we can't handle this. Instead of getting penalized, they're going to ask the government to help bail them out, to help them make billing to help independent physicians and groups, just like they did for Silicon Valley and the founders who were struggling getting their cash, just like they did for banks that were struggling to make payroll and to handle the liquidity crunch. This is a case as old as time when monopolies is an economic program where if you're a business, perfect for you to become a monopoly because not only can you charge whatever you want from a pricing standpoint because you have no competition, but in case something happens and the system fails, it looks like you're going to get bailed out by the government. And that's what may happen here, where the government is looking to help some of these independent practices stay in the game because they're struggling so bad right now to make payroll because they're not getting their medical billing. So these are some of the things that are happening. I may even do an even deeper dive into what's happening with Change Healthcare and what does it all mean. This is something that is really fascinating. Someone who came from the networking world and is working in healthcare now, really being aware of how these systems are interacting and seeing the changes that are happening before our eyes is something that we all need to be aware of. So let me know if you like this kind of content. We kind of dive deeper into what does it mean to make your practice prepared for this new era of healthcare. Not only are you need to protect yourselves from different hackers and different changes and understanding all that, but you also need to be prepared for the future. New trends in value-based care, new trends in how to handle staffing issues when you have new workers, so Gen Zers who want to work remote. These are some of the challenges that you're running into in healthcare. As we dive deeper and deeper into this, you realize that there's ways we can navigate this and be ahead of the curve. Go check out some of my other videos where I can go into details in these different areas of remote workers and how to handle that, how to handle billing issues, how to think of new opportunities in clinical studies. There's huge opportunities, but you have to have the courage to go after it. So let's go on this journey together.